Next, we're going to talk about or finish out talking about treatments with bipolar disorder. So all drugs currently indicated for the treatment of bipolar disorder have anti-manic actions. They're mood stabilizers. Lithium is the oldest of these agents, and it was introduced more than 50 years ago. Now, some medications used in treatment of seizures are also used to treat bipolar disorder. Most of the drugs in the treatment of bipolar disorder are pregnancy category D. Very important to know that. Lithium, we have the drug stem, lith, in the brand names, so that helps us identify it. Lithium is administered to reduce current symptoms of mania and depression and prevent future episodes. So lithium is given when someone has the bipolar manic component. Lithium has a long half-life and increases the longer the patient takes the lithium, so it builds up in their body. Lithium is absorbed rapidly from the GI tract and gives it a rapid onset of action, and it's basically excreted unchanged in the urine. The half-life can double over the course of a year's continuous therapy, so that's something to be aware of. Plasma lithium levels and renal function should be monitored regularly to avoid development of lithium toxicity, which can be extremely harmful to the patient. See page 99 for more information on the drugs used to treat bipolar disorder. Now, lithium, and in the book it gives Lithobid as the brand name. Here it is, and there's a 300 milligram tablet, but there is also Escalith, which comes either in a capsule for its immediate release or in the controlled release as a tablet. We also use anti-seizure drugs in treating bipolar disorder. Valproic acid, carbamazepine, and lamotrigine are used for the treatment of bipolar disorder. They're indicated as adjunct to lithium therapy, so they won't take these alone. They will take them with the lithium, and that helps produce the desired effect. Divalproix Depakote, which is the one listed in your book. So as you see here, Depakote comes in many different formulations. We have the immediate release Depakote tablets. We have an extended release Depakote. So the delayed release. We have the spanchules or the sprinkles. Now, these are meant for the patient to actually open up the capsule and sprinkle the medicine on top of something like applesauce. So that capsule is meant to be open. It's not meant to be swallowed whole. So it's a little different. Similar to this, but not listed on the chart, but talked about in the paragraph and on this slide, is valproic acid. So valproic acid is Depakine in its oral capsule formulation, or Depakon in its injectable form. So Depakine comes as a capsule, and it also comes as an oral solution, and then Depakon comes as an injection. So valproate can also be given as an injection. So the thing about the valproics, they increase the availability of GABA, which is inhibitory, and since we use it in mania, it kind of calms the patient down. Now, you do need to note that the patient should take these drugs with water, not a carbonated beverage, and they should not use aspirin while they're on this medication. Carbamazepine, which is Tegretol, is another anticonvulsant that is used with bipolar disorder. So carbamazepine is the generic name, and Tegretol or Elliptal that I have on your trade and generic list are brand names for the product. Also, lamotrigine, which is Lamictal. So here's a generic lamotrigine and bottle, and over here are the brand name tablets, Lamictal. You see they have a different kind of shape and they're each a different color. And then this is a label. And you see here an example of tall man lettering, Lamictal. For the adverse effects or side effects, most of these drugs can produce sedation, nausea, and lack of coordination. So they all produce sedation, nausea, and ataxia. Lithium can cause increased urination, dry mouth, difficulty concentrating, as well as tremors. And long-term use can result in kidney toxicity, as well as elevated white blood cell count, a goiter, hypothyroidism, weakness, and drowsiness. Now, I talked about lithium toxicity on a previous slide. It's important to note the signs and symptoms of a lithium overdose. That includes diarrhea, dizziness, nausea, stomach pains, vomiting, and weakness. The patient should be instructed to call their physician if the signs of toxicity occur. Now, a special note with Lithobid, Lithobid tablets need to be discarded after 6 months. So they shouldn't have an extended, what we call a beyond use date, or the expiration date that we put on the label for the patient when they take them home. These need to have an expiration date of 6 months. They actually could become toxic. They're and definitely ineffective after 6 months. So we want to highlight that expiration date so the patient doesn't keep them hanging around. The warning labels used to treat, for drugs used to treat bipolar may cause dizziness or drowsiness or may impair their ability to drive. They should avoid alcohol. They need to drink lots of water. Again, water, partly because of the kidneys, especially with lithium, but water, not carbonated beverages with the anti-seizure medications used to treat bipolar. They can take it with food, drink, swallow whole, do not crush or chew. There is kind of an exception with that. Tegretol actually has a chewable tablet, so it's meant to be chewed. Avoid pregnancy. Again, these drugs to treat bipolar disorder are generally category D pregnancy risk, and they should not discontinue without the being followed by the physician. Sound alike, look alike. Lithium carbonate immediate release and lithium carbonate extended release. And then Depakote and Depakine. And I'm going to throw in there Depakon. Now, we also use some antidepressants and, we use antipsychotics and an antipsychotic-antidepressant mix. So fluoxetine is antidepressant and olanzapine is an antipsychotic. That brand name combination drug is known as Symbyax, and there's some bottles here that show you the labels for the Symbyax. Now, with a combination drug, this is kind of the first time we've talked about them, both strengths have to be listed. So each of the ingredients, so it comes 325. The olanzapine is the first drug, so it's actually 3 milligrams of olanzapine with 25 milligrams of fluoxetine. And then 625, 650, 1225, 1250, so that you can identify those tablets. And then we use the antipsychotic drug aripiprazole, which is Abilify. And Abilify comes in tablet form, and I have a photo there for you to see the different colors and shapes of Abilify. Okay, that is chapter 6, treatment of depression. Now it's time for questions.